Hello, my name is Bethany Russell, and I'm going to be talking about how COVID-19 impacted well-being. COVID-19 was declared a global pandemic in March of 2020. This took the lives of many families, friends, and coworkers. Laws were put in place that disallowed normal social connections and work schedules during this time. This was an unusual event that people did not have previous experience with, but everyone was impacted. For this presentation, we have three objectives. First, how were children and students' well-being impacted? How were adults' well-being impacted? And how were essential and healthcare workers' well-being impacted? Children and students' schooling environment played a massive role in impacting their well-being. A child's home learning environment is crucial before and during their first few years of schooling. This condition impacts readiness for school and further academic progress. During COVID, kids did not have a differentiation between school and home settings. A great example of this would be kids turning their cameras off during Zoom to sleep, play games, or go places. School was no longer a commitment, but a task that could be easily crossed off one's list. In addition, kids were not turning in assignments and grades plummeted greatly during their formative years of educational development. Due to the sudden change in academic performance for children, stress and anxiety increased profoundly through higher levels of emotional dysregulation. This is understandable since the change was out of their control and no one knew when normalcy would return. Children of this age were already technologically advanced and used devices for recreation, so I wonder if this relationship had anything to do with struggles with learning and focusing, especially while in the environment that used it freely the most. Siblings who took on childcare responsibility and associated stressors were met with increased internalizing and externalizing symptoms and declines in school performance. Due to job losses and changes in parents, many children were required to step up beyond their developmental age. I remember working 110-hour pay periods during my senior year, which caused school to be of a lesser importance. It is crucial to see how these factors relate with one another in case another similar event were to happen. For children and students with learning disabilities and disorders, the COVID-19 pandemic was a rough time. Children with ADHD's anxiety and inattention symptoms were associated with home learning difficulties. Children with neurodevelopmental disorders were not receiving the recommended quantity of support services, such as speech therapy, counseling, and the implementation of ILP plans during this time. Coming from someone who works with children with neurodevelopmental disorders and special needs, changes in schedules and expectations are profoundly challenging and stress-inducing for many. Since there was also no warning of this change, it's understandable that these children suffered academically. Outside resources such as speech and the use of teacher helpers are immensely beneficial to children with these conditions, and it's often the glue that holds their progress together, especially during early intervention. Through research and consideration of events, factors that impacted children and students' well-being include stress, anxiety, depression, low self-esteem, and isolation. Changes such as online schooling, no social interaction with peers, dropping grades, confusion or frustration with homework content, a lack of support or resources from schools, low motivation, increased duties outside of school, jobs, and fear for the future contributed to these impacts. Documenting and spreading awareness of these consistencies will benefit us in the future if a similar event were to ever happen, for we did not have much research or previous experience to base expectations of the COVID-19 pandemic on. If precautions were taken to prevent these occurrences, such as assigning online tutoring sessions and counseling advice for families, the life satisfaction of children and students would have potential to improve. Next, we will discuss how adults' well-being was impacted during the COVID-19 pandemic. The pandemic promoted fear for the future in adults in many ways. Some include job security, income concerns, family deaths, and a loss of sense of normalcy or when it would return. Profound focus on the future often leads to poor mental well-being since current happiness is not benefited or focused on. Many believe that once they form a family, get a better job position, or make more money, they will be happy. This thinking leads to the individual looking forward to this time and fantasizing about its potential for their well-being inaccurately. which ends up being more of a letdown than a celebratory moment. I believe a similar process occurred for adults during and after COVID. They likely believed life would be so much better once restrictions were removed and illness rates decreased, but many were met with difficulties, struggles, and stressors upon assimilating into regular life, which contributed to worsened well-being. This finding supports that current well-being should be considered over all else, and that this contributed to lost time and a lengthy period of low life satisfaction for adults. Social media played a large role in impacting life satisfaction for adults during the pandemic. Observing expressions of distress in others can provide fear-relevant information about stimuli, people, and events. This finding holds relevance to the aversive social media atmosphere during COVID-19 since many were posting videos ranting about worries, beliefs, news regarding controversial topics, and misinformation. This panic could have influenced fear or information regarding nerve-wracking events. It is interesting to consider how fear was contributed across society, for it gives us insight on how to avoid these issues in the future. Even though social media did benefit well-being in some ways during the pandemic, such as through social connection and relieving boredom, the negative aspects seem to take a more meaningful toll. Since distress, fear, and anger were so easily spread online during a time when individuals were on their phone the most, this impacted adults' well-being immensely. Culture played a meaningful role in impacting the well-being of adults during the pandemic. Individualistic cultures such as the US differed in their reports from collectivistic cultures such as China. Both Chinese women and men suffered from fear at the start of the pandemic, but men experienced more prolonged depression, anxiety, and chronic stress due to their family role of being the breadwinner. It is crucial to identify differences in cultures and the factors that contributed to well-being during this time, for every country varies in some way. Identifying these differences also allows us to see methods or structures that benefit other countries that the US lacks. In comparison to China, there are more single-parent families and individualistic priorities in America, which likely contributed to the different reports on well-being. Through research and consideration of events, adults' well-being was impacted through factors such as dwelling on the future, ignoring current mental health, great worries revolving around finances and work, overconsumption of social media, and differences among cultures. All of these impacts include high levels of stress, depression, and anxiety that were maintained for a prolonged period. In addition to these findings, one must consider if the conditions were learned from their children through observation. Bartel's 2015 study found that there is adequate room in statistics for environmental factors to impact well-being. If a child's protector in their environment is struggling, they may feel unstable or fearful also. For our last objective, we'll discuss essential and healthcare workers and the factors that impacted their well-being. We'll start with working conditions. Throughout the pandemic, many healthcare workers left the field due to inadequate work conditions and the emotional toll. This resulted in an extremely understaffed workplace during a time when nurses and doctors were needed the most. Burnout, stress, depression, and PTSD were common conditions that impacted the well-being of these workers. I imagine seeing unexpected and prolonged deaths at a rapid rate was not the average experience of these workers before the pandemic. Additionally, having to separate family, friends, and loved ones from seeing the patients must have contributed to guilt and sorrow in these workers. Working nonstop during a pandemic with no insights on when it would end could feel overwhelming and dreadful. For essential and healthcare workers, many hospitals lack the emotional and financial support healthcare workers needed during this time, such as paid time off, sick leave, insurance, online therapy resources, and resilience programs. Without these resources, burnout, stress, and depression are much more likely to form and maintain. Research has found that resilience programs go a long way in preventing burnout in the medical field, for this is a trait that helps workers push through hard or unpredictable times, such as a pandemic. If similar events were to occur, medical establishments need to ensure these resources are available to prevent worsened mental health in their workers. For our last topic, we're going to discuss the well-being of workers outside of the healthcare field. We're going to focus on factory life. A study done on workers in the meatpacking industry found that their environments were unsafe and job options were slim. Most workers in these environments were minorities who had to choose between being jobless or working in risky conditions without restrictions or social distancing. The choices these workers were forced to make impacted their mental well-being negatively, for they watched those around them get ill and pass away while they had to stay just to pay their bills. This contributed to similar issues in mental health as healthcare workers, such as PTSD, stress, depression, and anxiety. Essential workers outside of the medical field deserve more attention, planning, and restrictions to protect their mental and physical health. Through research and consideration of events, essential and healthcare workers' well-being was impacted by factors such as stress, burnout, depression, grief, loss, and anxiety. According to the individual's line of work, these impacts occurred due to unsafe working conditions, a lack of emotional and financial support, understaffed workplaces, and repeated experiences of grief. These conclusions are crucial to remember to prevent reoccurrences during similar events, since research proposed many potential solutions to these issues. The next two slides include all of the references for the research I used to put together this presentation. Thank you all for watching my presentation, and I hope we've all learned something about well-being and how it was impacted throughout the pandemic through various groups of people.